Welcome back to Healthy Communities News. I'm Hilary Russo. Throughout the year, we've had the privilege of meeting people in local communities who are serving on the front lines of the COVID-19 pandemic. 2020 has been a year none of us will ever forget. With the end of the year approaching, we checked back on several organizations we've profiled, including Community Servings in Boston. This team provides medically tailored meals to those with critical and chronic illnesses.
We've seen a 40% increase in the number of people we're feeding. We've delivered over 500,000 meals. It's so gratifying to know that we can bring that joy to people who feel forgotten in the midst of this crisis. We've seen such a level of dedication from staff and volunteers. It is so moving. One of the funny, unique things we've discovered is that families coming are often the most useful because they don't require the same level of social distancing. If they're in the same household, if they came in the same car, they can effectively work on a production line, shoulder to shoulder. In that first week, back in March, we shipped out 2,000 boxes of shelf-stable food to our clients. It was really like an insurance policy for our clients to know that if we weren't able to get there, they would have that in their cupboards. We've named these boxes Blizzard boxes. We are gearing up to deliver 1,500 Blizzard boxes to our clients this holiday season to make sure they have the food that they need. We're particularly proud to partner with CVS, who has donated the bags for all of these deliveries. So we'll be spreading the joy of good food during the holiday season in partnership with CVS Health.
The team at Branches in Miami is also finding ways to spread joy during this quite unusual holiday season.
Branches has always celebrated Thanksgiving by serving our community. In Miami-Dade County, we were able to serve 5,000 hot meals to people in need. People were so grateful that they could serve and be a blessing to someone else, and families were grateful to be able to receive a hot meal.
Now the team is gearing up for the holidays in a new way.
Parents would hear things from kids like, "Oh, Branches gave me better gifts than you gave me, Mom." So we set up a store. And so the store is called Under the Tree Toy Shop. Parents are able to buy the gifts, at 90% off for their own children. The parents get the credit and not us. And that really has been a game changer. Parents are proud. They want to be able to give to their kids.
It's all about creating a sense of community and stability for the students they serve every day.
Kids are here and they're happy and they're laughing and they're engaged. They get to see their friends. Kids are really opening up. They're sharing the struggle. They're sharing the frustrations. And we're able to do that in a safe way, in a way that really is meaningful. And that's really important to us. When kids are laughing, you think, okay, this is good. This is good.
Earlier this year, we also spotlighted the historic Vine City neighborhood on Atlanta's Westside. There, the folks at the Good Samaritan Health Center are providing health care to residents who might otherwise go untreated. That includes a walk-up COVID testing facility created in collaboration with CVS Health.
We are currently testing about 130 people per day. Next week, we'll actually move to testing about 200 people per day, thanks to additional funding from CVS. The testing positivity rate fluctuates. Over the summer, we were regularly hitting 40%. We saw 40% again about 2 weeks ago. What that means for our testing site is that we're clearly reaching a community that needs testing and values it. And that when people get that positive reading, it's enabling them to make the changes that keep other people safe. The COVID helpline has been one of those kind of bright silver linings of this entire process to me, because accurate information and trust and getting people routed the correct place is really critical. We have responded to over 20,000 calls since starting that helpline, and it is entirely the work of an incredibly dedicated team of volunteers. For my staff, we've had very, very minimal, almost no turnover during this pandemic. They are doing it with grace. They are taking on folks that are more stressed out, and they are loving them through this.
With a number of vaccines in the pipeline, everyone is beginning to look forward to what comes next.
I know for me, as soon as I can get the vaccine, I'm going to do it. I want to be completely transparent in my experience and my decision-making around the vaccine so that it opens up conversations and creates trust with my patients.
I think that the story of vaccines interweaves with the racial equity conversations that America is having right now.
We have to start with a posture of understanding and owning that mistrust, and that is the fault of a system and the fault of persistent racism, and not the fault of individuals or their communities. Hopefully, through accurate information and honest conversations, we can help people feel safe about making the choice to get vaccinated.
We look forward to talking about vaccinations in an upcoming show in what we hope is a happy and healthy new year.
We have so much bottled up optimism after such a dark period that I think we will overcome the trials that we've all lived through, and new innovations will come forward, new energy will come forward, and I really think we're going to come into a really good period.
We have learned so much from 2020. I believe that we can face any challenge in 2021 with great success.